Okay, thank you so much for your Thank you.
You can help me.
Okay, he's coming in now, Mom. Oh, hi, Dr. Posadas.
Hey, Patrick.
Hey, it's great seeing you.
Good to see you. Hey.
How you doing?
Okay. All right.
Yeah, there we go.
How are you feeling? You're a little tired. Are you hurting?
Talk louder.
Are you hurting? Where do you hurt?
My spine, my hips.
I saw that you met with Dr. Hope the other day. She was really worried about your low energy level. Listen, I'm going to tell you, the scan that you did was helpful for me to understand where things are and to kind of understand this whole picture. I don't know how you did it for so long, Miss McDonald. You kept that thing under control, but it finally it grew and it spread, Mrs. McDonald. And you know, when I looked at that, I said, "Wow." The only thing at this point, I wouldn't even remember how we kept pushing you to meet with Dr. Sandler and talk about radiation. That's not. You would need chemo at this point, Mrs. McDonald. I'm looking at you. I know where you were, you know, a year back. You're all, you know, you're all fired up and ready to go for some good ice cream. And right now, it looks like coming over to see me just completely wore you out. If I gave you chemo on top of all this,
If you gave me what?
if I tried to give you chemotherapy,
Me, so.
I would do you much more harm than good.
Yeah.
You would do what?
I would hurt you with chemotherapy, if not kill you, Mrs. McDonald. I don't want to do that. And it just wouldn't help you. I think when I was reading through the discussions that Dr. Hope was having with you, I know she started to kind of get hospice services
That's right, yeah.
out to you. I gotta tell you, I think it's a pretty good idea. How do you feel about that?
Hospice would mean what?
Hospice is kind of an interesting thing, Mrs. McDonald. We talk about hospice when we hit a medical condition like a cancer where our hands medically are tied in terms of giving aggressive therapies. But it gives us a way to take care of patients and give them resources that they can't get otherwise. So what for you would be a good advantage of hospice? Let's say you were having aches or pains or not feeling well. Instead of Patrick packing you up into a car and trying to drag you out here to Cedars to see Dr. Hope or me or somebody else, they come out to you. They put equipment in the house that you and Patrick and anyone else and some nursing staff around coming to visit you to help you out to stay on top of your situation so that you're not always waiting for something bad to happen before you get attention. They stay ahead of that. What they can't do is they can't put chemotherapy into you, they can't do surgery on you.
That's too far gone.
That's too far gone. And none of that would help you. I would tell you, if people started doing those things to you, they would hasten your death rather than help you. What I can't tell you is how much time is on the clock. That's between you and the good Lord. But I'll tell you what, you shouldn't burn your energy on sitting around waiting for doctors in exam rooms, or getting shuffled around from hospital or clinic to, from home and back and forth. I think that's just too much for you. Does that make sense? I think the hospice thing is a good idea, and I can coordinate with Dr. Hoke on that.
Okay, what would it entail?
So the first step would be having some folks come out to meet you and Patrick and anyone else that you would want involved in this kind of process. Hospice care is care that's done in your home. Okay? So there's a good and a bad to that. Home is familiar. Okay? Where my mom got really, really sick, we were taking care of her at my sister's house, but the place that she wanted to be the most was home. And so eventually we brought her home and we had hospice care for her. And they helped me to take care of my mom. I'm going to tell you, in the same way that Patrick's done a lot to take care of you, he'd still be there doing all that. But he'd have a lot of resources. Because right now Patrick spent a lot of his time trying to, coordinate things with people in offices on the phone and so on and so forth. It's a different thing when they're coming to you and asking you what you need. And I think that would be a good thing for you. Okay?
So I would be at home?
You'd be at home. You could do what you wanted to do, Mrs. McDonald.
Yeah, but I mean, the choices are, I would be at home, people would come and visit to take care of me.
To help take care of you, yeah.
What would it entail?
Usually a nurse will come, so you have Patrick and anyone else that you have typically in your house to help take care of you. But on top of that, they would bring over some equipment. They'd probably send a nurse over at least between 1 and 3 times a week to check on you. They probably also send some kind of social worker or something to assess what needs they can get you. Remember, with everything that you've done by paying your taxes and being a good citizen, this is a resource that you've kind of built up. It's part of what Medicare will cover for you. Okay? All they need is a doctor to say, Mrs. McDonald is sick enough that she should be allowed to enroll in the hospice services. And that's pretty easy for any one of us to do on the basis of your scans. And honestly, Ms. McDonald, at the level of energy that you have right now. Because
I would remain at home?
I'd say, the answer is yes. But if you said, listen, I feel pretty good today. I kind of want to go out and get some fresh air, maybe go have an ice cream cone or go down to the store or something like that, head out to the park for a few minutes. No one would chain you down to the bed or block you from leaving the building. But at the same time, if you were feeling really, really tired and Patrick was having a hard time kind of just keeping after you, they would be sending extra support folks in to help Patrick or the rest of your family and give them some real medical backup. Okay? And this can be important because as much as family members are devoted to you, part of the reason to come out to the hospitals and the clinics is to get kind of expert guidance and resources from trained medical staff.
At this time, Patrick is the only one taking care of me. The others are staying away because
it's a complicated.
There's friction if they try to come in and say something because they're not there all the time, and their advice is...
I remember things being a little complicated.
Yeah.
But I know both Dr. Hoke and I know that Patrick's been working real hard to keep after you. But even as devoted as he is to you and the situation, Mrs. McDonald, he's not a nurse, he's not a doctor,
I agree. Totally right.
He doesn't have the kind of additional equipment. Let's say you were getting weaker to the point where having you in a regular bed is not as good as a hospital bed where you can adjust, ankles and have you sit up and whatnot. Hospice service would provide that for you. Okay. So the first thing they would do, Mrs. McDonald, they'd come over, visit you, visit the house, see how you're set up, see what you have available, and make some recommendations about how to set things up in conjunction with you and Patrick.
Mm-hmm.
Then they'd come up with a schedule of how people would come over, what resources that they can supply. And the good news about being here in California is it's not exactly a one pony kind of town. So there are different hospice services. So they come in and you're like, oh my gosh, those were the most horrible people I've ever met. I don't want them anywhere near me. We go to the next hospice service because there's plenty of good ones around here. We happen to work with a few very good ones here, but I can tell you, different people have different needs.
Mm-hmm.
And, you know, it isn't a one-size-fits-all proposition. You're as tired as you may be. I'm talking to you, and you're still Mrs. McDonald in there, okay? So you can tell me, yeah, they're good people, I can deal with them, or like, oh, no, go away and don't bother me.
Mm-hmm.
You can still very actively play a role in all this.
I could what?
You can play an active role in the decision making. And I think that'd be better, because if you get to the point where you're having a harder time expressing yourself, that's all going to fall on Patrick's shoulders. And speaking as a son, it's a pretty heavy burden to carry for the sake of your mother. Not that he's not willing to do that, I know that he is, but I want him to be your son even more than being just a caretaker, okay? And I think he wants that too. Patrick always wants what's best for you, but he does need some guy, and he knows that. That's why he brought you out here.
Well, that's why we have right care, coming by, because we have a nurse coming by once a week.
Yeah.
And having a bath lady coming by, because I'm a man and she doesn't want to be bathed by her son. So, we've had that for 3 years. So.
And this would be kind of an.
But I can't do everything.
No. This would be an escalation of that. So we changed the name of what you were doing from kind of visiting nurse and home assistance to hospice. Mm-hmm. The agency that you're working with may actually have hospice services that they work with to keep things relatively smooth for you. Those are things that maybe Dr. Hope and I can explore in conjunction with the social workers that we work with. But what's most important is that you're willing to do that. But I'm going to tell you, as a doc that's seen you and seen how you've been keeping this thing at bay for such a long time, it broke my heart to see the scans, Mrs. McDonald, because I'm kind of used to seeing you and looking at those scans and saying, how the heck did she do that? It's just kind of sitting there, and that's how our visits have been. But even, I saw those scans. But what's even harder is seeing you as tired as you have been. Usually you're coming in here, the two of you are joking, you're having some coffee, and then, Patrick promises ice cream or something else at the end of all this kind of business. It sounds like even all that might be too much for you. You look like you've lost a little bit of weight too.
150 pounds. I don't know whether that was a weight or gain or a loss.
You're looking different. You're looking tired, and you've lost muscle mass.
I stay at home all the time. I don't go anywhere except to the living room, sit in the chair at the window because we have a circular street there, and so I keep up with the neighbors and everything.
Does that keep you happy and keep you busy? As much as you can?
Then we have a neighbor, Barbara, that, from South Carolina that comes by, too, and chats for about an hour, right? So.
That all sounds good, Mr. McDonald. Yeah. Look, whatever time that you have left, it could be a while. You've surprised me many, many times in the past. As much as I don't like these scans, there's something different about you and different about this cancer. Something's definitely changed from where we were. But you should keep on being you, and you should, enjoy the time you got left, and put as much of that charm and joy that you got out in the world, okay? Because Patrick enjoys it a whole lot. That I know from seeing how he, and it sounds like there's a few other folks in the neighborhood that do that.
Well, he doesn't work. He stays at home and takes care of me.
It sounds like that keeps him pretty busy, Mrs.
It
McDonald.
keeps him busy, but also it interferes with him having much of a life too. So
He's kind of responding to the situation as it needs to be. But I think I'm seeing the trajectory that you're going into. It's more than what he's going to be able to handle with just a once-a-week nurse and bathing person coming in, and even a Meals on Wheels type assistant. You're going to need more than that in the not-too-distant future, if not immediately. And the good news is we can get it to you. We just got to change the name of it a little bit.
Yeah.
well, I don't want to just be a drain on him completely. It's bad enough.
He's never complained about that, Mrs. McDonald.
Yeah, I know he's decided that he's going to sit at home and take care of me.
Even if we go into hospice mode, you're still going to need someone to be there with you.
Yeah.
And, I don't want to burden Patrick outright, but he's kind of the person that knows you best and has stuck with you through the ups and downs of all of this. So he's actually the best suited person for you, and I think you already know that. And I think Patrick knows that.
Well, I'm here, to support her, right, to bring her to her appointments and to provide her companionship and cook all of her meals and do her laundry and stuff. But I'm not in the medical profession.
We gotta get it.
Yeah. I design microchips, and I'm very good at that, but I don't think Dr. Posadas knows how to design microchips. I wouldn't ask him to, all right? And I don't know about the medical care field either, so...
So as your doctor, I'm telling you, I think getting hospice services is a good idea at this point. Does that make sense?
I think it's a good idea. I'm all for it.
Don't buy it.
Absolutely.
If it ends up not being a good thing, Miss McDonald, you move on and do something else. Okay? But with what you're kind of describing right now, if we get the right service, it's going to help the two of you kind of really improve quality of life. And I know you want to do that for him, and Patrick wants to do that for you. It's a very mutual thing. But you definitely need more than a once-a-week nurse and an occasional bathing person. It's just not going to be enough. If you get weaker, any weaker than where you are right now, everything that Patrick's doing isn't going to be enough.
Well, I'm not qualified. I might be your son or a good companion, and I might do these.
You can't expect.
But I don't know anything about the medical field, so...
I'm going to work with Dr. Hope to get all that together, okay? She and I have communicated a number of times about you. Now that she's seen you and I've seen you, I think she and I have an agreement about what we need to do, and we just need to find the right kind of fit for you. So we're going to work on that for you, okay, Mrs. McDonald?
Okay.
You let me take care of that. Patrick will keep doing his thing with you. You keep enjoying the circular drive, that you got out there, okay?
Yeah, I've become a neighborhood busybody.
Hey, the neighborhood needs a busybody. That's okay.
I don't spread it around.
Patrick, what else is kind of going on that we should address?
Well, I just scribbled down, a couple of things, and, like you were talking about hospice care. I was thinking about, if there was like a 1-star or 5-star, I don't know, which one you want us to call. In the San Fernando Valley.
What we're going to do is we're going to work with social work to see who's around you and who our medical center has worked with. Let Dr. Hoke and I kind of coordinate that a little bit, and people will come out to meet you, and then you'll say whether or not you like them. If it turns out you don't like them, like I said, we'll find another one. Even in the San Fernando Valley, it's not a one-only kind of business. We can find someone for you. Okay? So let's just find in terms of, Patrick's looking for kind of a Yelp equivalent where someone's got 5 stars and someone's got 2 stars.
Right, yeah.
It's kind of, there's no kind of open rating system where I can go to like a Siskel and Ebert, and you get 2 thumbs up or 1 and 1 down. It's very, it's almost kind of like driving a car. You kind of it's got to feel right for you, and that's the most important thing. Okay.
Yeah. The other thing is, when we saw Dr. Hawk, she said she prescribed levotiraxine, 500 milligrams. You know, and that, I think that, you know, because there was some inflammation, right? And that seems to be working.
Well, that's good.
You know, and she's like on her 7th day out of 10 days.
Oh, good.
Right?
Yeah.
I still have to change her pouch, but also she's got a bladder tube coming out that has a cut in it before the siphon that I've been talking about since October. You know, I was hoping, you know, that somebody could, you know, a nurse here could have a look at it, because I don't want to, you know, to get the bladder drainage, you know, working properly, right? Oh, the only thing I didn't put gauze around it, but you can see, you know, that. I'm sorry, Mom. You know, this thing right here. You know, it's happening before the siphon.
Yeah.
You know, the siphon's here. You know, it leaks here, but if all I can do is wrap gauze around it. But before here, there's a cut, and it's coming out. Right? You know, it's like oozing out, but since there's no siphon hose, then that means it's not going down in the pouch. You know what I mean? Because air is getting in back here because there's a cut. You know, like the hose is like cut in half, and it keeps on oozing out, and I keep on putting stuff around it, and you know. And
let me ask James what we can do about all that. But
the
thing is, Patrick,
it's outside of the body, though. I mean, a little cut, you know, with the siphon hooked up, you know, and then that's good, right?
This is a chemotherapy clinic. I don't have a lot of tubes and things, so I'd have to figure out.
Yeah, but I mean, you're like the head of oncology here, you know.
Yeah, oncology is chemotherapy.
I don't know. You pick up a phone call, you know, things get done, right?
Patrick, I gotta figure out where.
Who put that in for her?
Yeah, I understand.
I put it in, but we don't want them. It would be too much stress to change the whole system. With asking us to change it beyond the point of the joint.
Yeah, that's all. You know, outside of the body.
Yeah,
it's like a plumber can do it, right?
But we need the right. I gotta figure out who's got the right parts, Patrick.
That's okay. That's a big help.
But the levofloxacine's a good idea, because it looks like it's already been kind of doing its thing.
You know, maybe, I don't know.
Because I would tell you, the other thing, Patrick, if we get a hospice service involved, we can probably get them to change that tubing too, because they should have those things. The hospices have medical equipment suppliers that work with them, and the medical equipment suppliers definitely have that kind of tubing.
Yeah, but you know, a vacuum has to be created, you know, coming out of the bladder before the siphon little fixture, right? You know, and I know Cedars Sinai put it in, so I just wanted to make sure, that's working properly, right?
But to do all that, we'd have to send her back to interventional radiology, and that's a big invasive procedure. Now that'd be too.
Yeah, no, we're not talking about taking in or taking out.
Right. And so if we're talking about just a tube change,
just outside of the body.
I'll almost tell you the easiest thing is if we get you into a hospice program when they come.
We're going to do that. Yeah, we're going to do that.
When they do the evaluation, because they have equipment groups that are associated with them.
Yeah, I understand.
They'll have the equipment and the personnel to do that.
Okay, well, all right. You know, then
let me do that. If there's something I can do quickly while you're here, if I can.
Yeah, that's okay, right? You know, and then Dr. Hawk says no anti-inflammatory painkillers.
Yeah.
All right. No anti-inflammatory painkillers. Now, she does need, you know, obviously a Tylenol is not going to be working, you know, as her, you know, condition worsens, and which it will, and you're well aware of it. We're all here are well aware of it, you know.
Her kidney, so that's why. But then, I mean, if she's going to hospice, then.
Well, I don't know. I'm not a doctor. You know, I just mentioned it was on a piece of paper, you know, so.
Some of the anti-inflammatory medications can strain her kidney function more, Patrick.
Yes, right.
And we kind of, depending on what we're doing, we kind of don't want to do that, but there are times that benefit may be greater for her.
Yeah.
So again, once we get a hospice involved,
Yeah,
it can help
well,
us make some decisions about that, because there may be some appropriate, it's hard to give a firm, hard no, never.
Well,
It's kind of situation dependent,
Right.
and it shouldn't be,
I wouldn't put you in that position. You're a doctor, right? You know, I'm not.
No, but
I don't
but I don't
judge.
wanna
I
do-
don't judge you. So.
I don't want to put that weight on you, because you need someone with a little medical expertise to help you navigate those things. So I think
Yeah.
getting someone in who's seeing your mom regularly,
Yeah.
like
Mhm.
one of the hospice nurses, could help us to navigate that.
I'm just passing the message from Dr. Hawk.
Yeah, no, I appreciate that.
I'm not a doctor, right?
For now, I'd say, I would use probably
Yeah.
non-inflammatory pain medications for pain that she's having.
Uh-huh.
Because, listen, I don't want her hurting. I want her enjoying herself.
Absolutely, yeah. And we don't want her all loopy and, all drugged up either,
No,
at that
and
point.
so that's why we gotta get someone that you can work with, Mrs. McDonald, because if someone's over-medicating you, that's not good either.
Yeah, that'll kill you.
I don't know how much time you got, but no one should cut it short for you.
Right.
So until it's your time, it's not your time, and you better go and enjoy and do those things that you gotta do. You should not be living like you got one foot in the grave, because I don't know when that time is. I know you're getting
Absolutely not.
weaker, but you still have energy. It's still a heck of a trip to get out here,
Yeah.
okay? And I know that.
That's it. That's all. So we're gonna get hospice care, right? And
Let me see if I've got an answer for Patrick's tubing question, okay? Because I know that one's been bugging him and bugging you too. But I'll definitely coordinate with Dr. Hope. Give me a minute to see if I can find an answer with James on the tubing.
I'd love that, because it's been driving me insane for like the last 4 to 5 months.
Let me see if I can get an answer, okay?
Yeah. Well, anyways, yeah. See, I had a list of of questions, right? I had one on here. How long you think Stephania's gonna live, right? Right? And he says he doesn't know, right? You know what I mean? I mean, he can't believe you lived this long. So he can't give an answer, right? But he's saying you like being in your home. You probably would like to stay there, right? And so he's recommending another nursing service, right? That's gonna provide better care for you, right? So you don't, as your condition progresses, right, you won't be in pain or anything, right? And they're specialists.
Okay. So James has been running around looking.
Oh yeah,
in the
that's fine.
clinic.
Yeah.
You'd have to get one of the surgical clinics who have tubing.
Yeah, it's a tubing thing. I feel like I can go down to Home Depot and get.
No. You want medical grade tubing that's
Right. Yeah, sterile. Right?
Yeah. The best and safest thing.
I don't know how to do that.
No, you don't.
I don't want to.
So the best thing the quicker we get you hooked into a hospice service that
All
has
right.
proper support and equipment,
Okay.
and a nurse that can do that,
Yeah.
that's really going to be the safest thing for your mom.
Okay, we'll do that.
We're going to put that on the list of things that we need the hospice to tend to.
All
We're
right.
going to put that on there because it's important.
Yeah, I'd list that as number one.
Yeah, I think that's a big quality of life thing for both of you. Okay.
Well,
So let me get working on that for you because I want it done and Patrick wants it done properly too, rightfully so. Okay. But yeah, it's just let's get them to change it from kind of the joint on down because that's what needs to be done.
that's all. Just so it drains, right? Because Dr. Hawk prescribed this antibiotic,
Yeah,
very strong antibiotic, and I'm worried about the buildup because it's not draining, like it should be because there's a little slit in the hose and.
That antibiotic will stick around for all, give it some protection.
That's all.
Well, we'll get that thing patched up for you, okay? But I want the right people doing it.
Yeah, absolutely. I don't want to,
I'll get working on that with Dr. Hope. Okay, you guys don't worry about that. Okay?
All right, well, thank you, Dr. Posadas. I really appreciate saving my mother's life, when her bladder was full. I mean, Jesus, she spent 2 weeks in the hospital. You saved her life.
No. You just keep doing what you're doing. Okay? It's good to see you, Mrs. McDonald. At least you got a little smile for me in there.